Hello, good morning. This is Michael from Back in Motion, Sarasota, and physical therapy. Today I would like to continue talking about the rotator cuff. In my last video podcast we talked about posture and about the function of the rotator cuff muscles and what kind of movements are supported by those muscles. Today I would like to talk about what you can do at home and how to differentiate between different symptoms of shoulder pain. A lot of time we have pain in the front of your shoulder, maybe on the side, maybe like diffuse around here, it's radiating into like your arm. And it's really hard to say sometimes if it's the rotator cuff, which does like either internal or external rotation of your arm, if it's one of those muscles that has maybe a partial tear or any inflammation. Sometimes we talk also about impingement, which is like a space issue under the shoulder roof, and that will also produce pain in that area. And sometimes it could be also the biceps tendon over here, that big muscle here that also attaches here, that could be a problem. So it could be a space problem, impingement syndrome called oftentimes, where like one of these muscles, tendons, is impinged under the shoulder roof. It could be specifically the rotator cuff, which comes mainly from over here, those muscles, or it could be the biceps tendon from down here, or so that's usually different areas that all would present sometimes with similar symptoms and without specific muscle testing. And testing in an office, you could really hardly tell apart what the problem is. Sometimes even MRIs are necessary to tell the difference. And a lot of times they occur at the same time. But with all of those, important is for therapy, we would do similar things. We would always try to present with a better posture and try to get from that forward up position to the down and back position of our shoulder to reduce the stretch or stress on those muscles and create more space in that area underneath. However, our natural instinct is to bring that shoulder up and forward to protect it. And that's one thing we have to get rid of. So that's called like an upper trapezius compensatory pattern, where we use that big muscle here to go up and protect the shoulder. So with all these problems, we usually try to have good posture. Head would be straight up, our shoulder would be back and down, and we try to relax those upper trapezius muscles here. And we also would try to perform shoulder lifting or arm lifting without hiking our shoulder. So that's one important thing. That's more about posture. And in the next podcast, we will talk about specific exercises that you can do in order to strengthen muscles that allow your shoulder to be down and back, and also to stretch muscles that will allow to maintain that good posture. That's everything for right now. Thank you for watching. Have a good day. Bye-bye.